images, you get some words here. And now you shall try to remember as many of these words as possible. And then in some minutes, you're going to get an individual test instead of a common test. Okay, that should be enough. So, which areas are involved in different types of memory? We certainly have the short-term to long-term memory transfer, which is in the temporal lobe and the hippocampus area. When it comes to working memory, as I said, this is mainly the frontal lobe that's involved. Parietal lobe, we know that we have spatial memory, the remembering where we are in relation to whoever, where certain things are in relation to certain other things. This is our long-term memory storage. This makes sense since this is also where we have the sensory information about our own body coming from the somatosensory senses. We have the visual input coming into the occipital lobe, which feeds into also the parietal lobe. So you have this grid, you could say, of the external world together with our information of our own personal body. So relations between the external world and our own body is sort of what you have located in this area. The cerebellum and the striatum, the basal ganglia basically, are involved in procedural memory and the motor memory in general. The diencephalon, which also receives quite a lot of the output coming from the hippocampus and the medial temporal lobes, are also involved in memory and especially in the explicit memory. It's especially clear in the so-called Korsakoff's syndrome, which is quite often seen in severe alcoholism, where you have very severe retrograde and anterograde amnesia and a very severe degeneration of the diencephalon. It's related to deficiency of vitamin B. The medial or the temporal lobes are also involved in especially storing memory of faces. So this is where we have a long-term memory of especially face recognition, our ability to recognize basically our grandmother or other people, of course. Basically because we have the visual input coming into the occipital lobe here in the back. We have then two different streams of information processing which we use in order to interact with objects in our surroundings. One is where the object is, which makes us capable of actually grasping an object and knowing where the object is. The other bit is the so-called ventral stream, which is information about what the object actually is, what are the properties of the object, and included in this is also basically face recognition. So this is just to show the response of different cells in, or basically one cell here, but cells in the temporal lobe responding to different visual patterns. So in this case you can see what in a monkey requires that this particular cell becomes active. So you have to have sort of an image with two circles here indicating eyes and a horizontal line contained inside a larger circle, which is sufficient in order to get a good response here. If you just put the two eyes, you have no response. If you just put the mouth, no response. If you make it a square instead of a circle, no response. Circle without the eyes and the mouth, no response. If you put the circle on top of a square, good response, etc. So what this is all about is basically that it is cells which sort of make feature recognition. It looks for specific features, in this case, big circle, two small circles, and a straight line, which will then get this neuron to discharge. It could be any other combinations of these different features which make these cells capable of recognizing eventually faces. So one of the important things is also here that it's not stored as our face recognition is not stored as such as activity in specific nerve cells. We simply wouldn't have enough nerve cells to recognize all the faces that we can recognize. So it's a pattern of activity in different neurons which code different features. So this one coding basically this pattern and other cells coding slightly different patterns, and the combined activity of all of these is what makes us capable of recognizing faces. There are examples, though, of specific cells that react only when specific faces are shown in the visual field. There was a paper some years ago showing that there are some neurons in the monkey, in monkeys, I would say, that reacted only to images of Brad Pitt. But apart from that, it hasn't really been shown that there are so-called grandmother cells, cells that only react when you see your grandmother. But in any case, if you should happen to get a lesion in this area, this part of the temporal lobe, you end up with what is called, I think there's a P too much, prosopagnosia, which is basically the inability to remember faces. And this was described in a book by Oliver Sacks called The Man Who Mistook His Wife for a Hat, which is basically the story of one patient who had a lesion in that area and was subsequently incapable of recognizing faces, and to his embarrassment also the face of his wife. He just couldn't see that this was a face and that this was his wife. So when she was sitting right across from him, he just couldn't recognize her. Immediately when she turned around and he saw her from the back, he could recognize her by the way that she was walking and the way that she was moving and looking from the back. But when she turned her head and he saw her face, it just didn't make any sense to him. And this is actually quite common to have small problems like this. Not as severe as this, of course, but basically to have this inability to recognize faces, which is very often quite embarrassing. So in one of his newer books, Oliver Sacks has also actually described that he suffers from that kind of disability himself. So he has an assistant, because now he's a relatively famous person and he's giving lectures all over the world, and he very often meets people whom he should know, but he fails to recognize them. So he has this assistant who travels with him all over the world and who can sort of fill him in so that it's not too embarrassing when he cannot remember who he's talking to, even though it should be someone that he should be well acquainted with. Yeah.
Må jeg sige det?
Ja.
Ville det ikke være nok, at personen så siger, jeg ved godt, du ikke kan genkende mig, men jeg hedder Hansen?
Sure.
Så burde den der...
Then he knows from the name who it is. But his problem is that if people don't know that he's suffering from this, it's embarrassing because it sort of sends a signal that I'm not important to you or whatever. So to many it is an embarrassment. I'm not very good at remembering faces either, but well, I can remember faces. I know that I've seen people before, but I just cannot connect it with any name usually, or with any whatever situation. But so this is actually different. This is just when you look at a face, it doesn't really make any sense to you, And it can even go so far that you can't even recognize it as a face, that you actually see a hat instead. And then it's really severe. That's not the case for Oliver Sacks. It's just the inability to differentiate different faces in an efficient way.